This is Talk to Kedi, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on yet another edition of your number one educative online broadcast, Talk to Kedi. Our topic of today is halitosis. We will discuss in depth what halitosis is, along with its causes, treatment, and prevention. My name is Felix Adedoyin. Welcome on board and stay tuned. In the studio with me today is a registered nurse with over a decade of experience. She also specializes in entrepreneurial healthcare, and she's responsible for several medical outreach nationwide, which eventually led to the establishment of an eye clinic that has helped hundreds of people in the early detection. Thank you so much for coming to our show today. We are delighted to have you again.
Thank you.
Yes, ma'am. In case you're tuning in for the first time, this is Talk to Kedi, your number one educative online broadcast, brought to you from the stable of Kedi Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. Welcome on board and stay tuned. In today's broadcast, we will focus on an important health issue affecting both men and women: halitosis, commonly known as bad breath. Study shows that halitosis affect both gender, but men tend to show indicates that men are about 1.5 to 2 times more likely than women to experience chronic bad breath. However, halitosis is often associated with various lifestyle factors such as high rate of smoking, alcohol consumption, even less consistent oral hygiene. Additionally, hormonal and metabolic differences, as well as certain health conditions that reduce saliva production, like dry mouth, contributes to the prevalence of halitosis across gender. There are numbers of causes of halitosis, but the vast majority comes down to oral hygiene. These and many more are what we're going to be studying in today's edition. Don't forget, you can be part of this conversation in the comment section. Let's engage, share insight, and learn together. If you have any question whatsoever pertaining to this topic or any other related question, feel free. Please leave them in the comment section and we will do justice to them before the end of the show. All right. Over to Dr. Tope Faniyi Omolara. I believe you are ready, ma.
Yes.
All right. Okay. So without further ado, I'd like to ask you, ma, what is halitosis? What are its main causes, and how can someone identify the underlying reason for their bad breath?
Thank you very much.
Yes, ma'am.
What is halitosis?
Yes.
Halitosis is called bad breath as per common parlance. But if I want to define halitosis, I will say it is a bad odor emanating from the mouth. It is an unpleasant odor, unpleasant smell emanating from people. It can be chronic or it may be temporary. We say chronic is something that stays for a longer period. Another thing is that we should know that it involves the nose, the mouth, and the throat. So that's the definition of halitosis. Now let's now look at the causes of halitosis.
Yes, the main causes.
Number one, like you said when you were introducing, is poor oral hygiene. You know, we advise people to brush at least once a day, but it's supposed to be twice a day. That is, before you eat in the morning and after you finish eating in the evening. And use the paste, enough paste. Then allow the paste to stay for about 3 to 5 minutes in your mouth. Now, that's oral hygiene. You know, when you eat, we leave debris, some particles in our mouth, which microorganisms will work upon and begin to cause tooth decay. That is oral hygiene. Another thing is like what you said about xerostomia, that is dryness of the mouth. It could be as a result of medical conditions or some drugs. And what happens is that a regular production of saliva in our mouth, as saliva itself has antiseptic, antibacterial in it that kills bacteria. So when there is a reduction in the production of that, it could give that one. Then mouth sore, mouth ulcer, tooth decay. Once there is a wound there, bacteria works on it, it will be smelling. Now, let's now go to diet. Another causes of it is diet. All of us know, you take ginger, you take garlic, you take onions, it will smell. Another thing is cigarette smoking, like you said. So those are the causes. Then we have diabetes, liver problem, kidney problem. All those ones are causes of it.
All right, man. So having known all these causes and probably the underlying reasons for some persons are bad breath, in your opinion, man, how can people effectively manage or treat halitosis at home? And when does a professional treatment becomes necessary?
Thank you very much. Like I said the other time, it depends on what it comes with and conditions. Take for instance diabetes, we have diabetes ketoacidosis, that is somebody, it will be smelling from the mouth. That is diabetes. Then when we talk about, you see that person, the keto body smell from their mouth. People with liver disease too, what happens is that some smell comes out that when you perceive, you will know something is wrong with that person. Now let's look at kidney failure. Because their function, the kidney is not performing to optimal, urea smells out of their mouth. So if you want to manage that, you first manage the condition, the chronic condition like the diabetes, the liver problem, the kidney problem too. Like I did not mention something like gastric reflux. Gastric is like a sac. It has a sphincter too. And when some people, their own sphincter will not zip, the zipper will not sit very well, and there will be a reflux of stomach content coming back to the mouth. And don't forget that stomach has alcohol. Of course. And this alcohol, there are certain bacteria that can survive the alcohol in the stomach. If it comes out, it will form ulcer and it will form wound. There's another case too that I want to mention, that is Sencken's diverticulosis. That is a situation in which the esophagus has a sort of blockage. The person will be eating like this thing we see inside chicken. When you open chicken, there is such a pouch that contains food. It is in some cases so, if they have such case, food will be storing in that pouch and smelling out. Now to manage, all those ones that are chronic disease will be treated, but to prevent it, is to be maintaining consistent or persistent oral hygiene, and do something like flossing, visit the dental department.
All right, okay. So man, with all this, you talked about food and some things. So I'd like you to speak specifically. Are there specific dietary habits or lifestyle changes that can help reduce or prevent halitosis? If there are, please can you share them with us?
Thank you very much. Like I said the other time, we're supposed to brush twice. That is lifestyle. Then avoid something like sugary, pepperish, like ginger and garlic. Ginger and garlic, they have a very strong odor that when somebody takes so your hair, like the onions, all those ones too, you take it in moderation. Now, chewing of tobacco, smoking cigarette, most people that engage in that habit, that they do have something like we call teeth decay. You understand? You see coloring of the teeth and coloring of So when you see all those things, you realize that it will form something like mouth sore and another thing like taking like unripe fruit, they have acid too.
Yes, the high concentration of
And
ascorbic
taking
acid
sweet
is always there.
things, those ones, it just form a place where microorganism will be able to grow.
Yes.
So taking those sweet things too, and sweet things, they are always very acidic too. It is a caution media for microorganism to enjoy themselves, to strive. And with that, so all those things, the one they are supposed to avoid or reduce, should be done. And do the right way, eat the right way, eat normal food, and monitor your diet.
We should eat normal food.
Yes, normal, not the junks, not the ones that are too sugary. You understand? Take more of a vegetable and fruits.
Okay. So someone that, let's say for instance now, someone that likes or loves using garlic to boil meat, eat some people be eating it directly. So how can such a person just manage such a situation?
Yes. You know, somebody that like taking garlic, or people that like taking, they visit Aboki to buy suya, they give them fresh onions. You see, once they take it, you even perceive it.
Of course.
No, they have to reduce and brush. Maybe after taking it, they brush. And people too that use teeth fittings, like gold teeth, diamond teeth, all those ones will hinder the person from brushing that particular aspect of the mouth. So it can cause to decay too. So you avoid all those things so that the person will live a normal, healthy life.
All right, ma. So what medical conditions are commonly associated with chronic bad breath, and should halitosis be a concern for overall health?
Definitely, like I said, I've mentioned some. Halitosis itself is like, you know, when I said it's a bad odor, maybe it's temporary or it's chronic.
Yes.
It's just a symptoms of something happening. For instance, you are medical, you are assessing a patient, and you perceive that odor of patient that have a rotten fish, a rotten egg, something as if the person eat dead rat. You know, that one will tell you that something is wrong in the life of this person. So is halitosis is, you know, is an indication of a serious issue in the body.
Okay.
Yes, it is an indication if it is not temporary or it's becoming abnormal. If it is not that the person has to decay, there is a wound in the mouth. Once it just go beyond that place and it's going to the esophagus, going to the is serious issue.
But I want to ask, could this halitosis be hereditary? Because I've seen a family whereby the parent had this bad breath, and even the offspring, who happens to be a friend of mine, also had this thing. So I want to know, is it that it is hereditary, or it is kind of a poor general oral hygiene from the family itself?
Thank you very much. I don't believe it's hereditary.
Okay.
It's not hereditary, it's just an upbringing and behavior in the family. You know, the way people behave in each family differs. Take for instance, they don't, in that family, like in a family where, okay, it's a routine that you brush twice, and they don't allow their children to go to bed without brushing. You understand?
Yes.
That one is something. Then if it is something, there is something they eat in that family, you know, once they eat the same set of things and do the same thing, it may be that it's hereditary. If all these rules are followed and there is no hereditary sickness, hereditary related sickness like I heard that that can compromise their immunity, like diabetes, like kidney disease, all those ones, if they are not, if there is not that they have it in the family, that is now
transferred to another generation.
It's not hereditary.
Okay.
Yes.
Okay. Are there any possible quick solution? For instance, like I said in my introduction, that people who consumes alcohol in the higher rate, I had some set of person whereby because of the higher consumption of alcohol, you find that the mouth smells often.
Yes.
So is there any solution that such an individual can just delve in immediately to actually to either stop the continuous smell, or just to stop it completely?
Yes. You know, like I said, you want to stop this thing or you want to prevent it, we have to make correct diagnosis and actually know that it's not that there is a sore in the mouth, there is a wound in the mouth. You understand?
Yeah.
Then now let's talk about the bad habits.
Mm.
Taking alcohol, in short, it's a big issue too. And smoking, all those ones, once those ones are ruled out, they don't smoke, they don't drink alcohol, they don't do all those things again, they don't do those things. Let the person brush. And if there is a wound there, I think there was a case of a lady who has this tooth problem. When she told me, I told her, use the gum care, our KEDI gum care. And she took it. And I told her that you can gargle with reishi, with warm water. And she gargled, and the pain, you understand. So those are the things somebody can do.
Okay.
Yes.
Okay. All right. So, ma, based on your clinical experience, like what you just said, what are the best oral hygiene practices or products to use specifically for reducing halitosis? The best oral hygiene practices.
Thank you very much. The best oral hygiene practices is to brush at least twice a day. Then number 2 is that drink enough water. We talk about xerostomia. You drink water so that you don't experience dryness. Drink water. And stop all the beverages that are over processed beverages that are sweet. The person should stop that one. The person can do a salt water gargle morning and evening too. That you put salt in water, hot small warm water, and you gargle with it. Then you take our gum care to brush.
Okay. All right. Okay. So, ma, coming from the angle of you saying that they should brush twice daily, I want you to look at in this angle. There are some persons that I've known that they will tell you that once they wake up, they don't brush.
Okay.
Probably they might eat, do other things until probably they're about to go out. That's when they will brush. Is this ideal, or can this be another factor to causing halitosis?
Thank you very much.
Because it is very, very rampant. I notice it nowadays.
The person that do not brush before eating, maybe the person do not want to experience bad breath outside. Does the person brush before sleeping yesterday in night to that time? Because it's not actually the habit we're talking about. We want to prevent it.
Yes.
So if somebody brushed yesterday night, now we believe that you have removed the debris, whatever is the thing that is there that is hanging there, then what is inside the paste would have killed the bacteria. Right. So if you wake up the second day and you say you drink water and you eat, then you brush, may be acceptable. But for somebody who did not brush yesterday, you have all those particles still in the mouth. You now eat with it. It will even irritate some people or irritate the stomach.
Yes. Because I feel it will definitely irritate the stomach.
Yes.
To me, I feel it is because I don't understand how someone will just wake up and you just start eating directly. All the toxins in the mouth that the bacteria has already introduced to the mouth, you're already taking it inside your body system, which could also lead to another health issues peradventure if there is any. So I believe it is very, very important for someone to always ensure to brush according to what doctor says. Brush twice daily. Ensure to maintain these hygiene practices.
And make sure that the paste you use. Some people do not know how to brush. You brush the teeth up and down, brush all the corners, you gargle, you rinse. Even before you rinse it, allow the paste to be there for like about 2-3 minutes to enter into the tooth, into the gum.
Is it while brushing or how?
During as you brush, you know the way people brush, they just brush.
Some brush with power. And you feel
and
blood coming out.
It's not actually the brushing that is really working. It's the paste that works inside the teeth.
Okay. All right, ma. So, ma, as I go to my next question, I'd like to ask you, ma, as a seasoned TCM practitioner, which KEDI products have you used in managing patients with halitosis? Can you share with us the dosage, the formula, how you're able to treat this person, and the success rate in general?
Like I said, number 1 is the brushing, which is the good oral hygiene, that you take the gum care, the person brush, and you apply a very good quantity to your brush to brush. That's number one. For the cases that I've told you about, if there is an inflammation in the teeth, the person can be placed on reishi. Okay. Reishi is an anti-inflammatory, you understand, product, an anti-inflammatory, anti-allergic, very good. Apart from this, swallowing 3 capsules morning and night, they can even put in warm water and gargle too. If there is any salt there, it will go. That's another thing. Vika is good. Vitamin C is there for teeth and calcium. You can use Vika. You can use Cod Active. Yes.
All right.
Then I want to say, concerning all those associated cases too, you can use any other. You can use other product depending on whether you have known that the person is diabetic, the person has kidney failure. You now use products that can do.
That can treat it, product can handle. Okay, I'd like to ask a question now.
Okay.
When you talk about peradventure someone has mouth ulcer, or probably the person has injury.
Okay.
In case, or let's look at this scenario: someone that brushes and bloods come out frequently. I've seen a lot of cases like this. Could it be that there is a sore in the mouth or in the teeth or in the gum that's causing this blood coming out per time each time the person brush, and could this also lead to halitosis?
Halitosis, like we said, is a bad odor, regardless of where it comes from, whether it's garlic or smoking or the sickness there. Is halitosis, unpleasant smell. Now, for somebody that is bringing is whenever the person is brushing and is bleeding, you know, when blood is coming out, is telling us that there is a wound or ulcer in that place. So there should be an examination of the blood. The person should be able to know whether there is an ulcer, especially if it is an elderly person that is, you know, that is very common with patients with diabetes. They will always have ulcer in their mouth. So when there is a wound there, you know that the blood is coming. Once there is a blood, you know there is a wound
in the mouth.
In the ulcer, there is a sore in the mouth.
All right. We have heard it all from Dr. Faniyi Tope Omolara, who has taken time to explain to us what halitosis is and everything that concerns halitosis. Before we call it a day today, I'd like to leave you with the Dr. Cap X tip for today. A good oral hygiene is the foundation for preventing halitosis. So, brush twice daily, floss regularly, and clean your tongue, and also keep bad breath at bay with the best herbal formula and gum expert, KEDI Gum Care toothpaste. Like I have here, KEDI Gum Care toothpaste. This is the best herbal formula that you can always leverage on to keep bad breath at bay. So please, our viewers at home, ensure to brush twice daily, just like the doctor has said. Make sure you follow the proper oral hygiene, which is, if you are not following it, then you are at risk of getting halitosis. But as long as you maintain proper oral hygiene, then you can keep halitosis at bay. On this note, we'll wrap this edition of Talk to KEDI. I hope you have learned something valuable about halitosis, its causes, treatment, and prevention. Special thanks to our wonderful guest, Dr. Faniyi Tope Omolara, for taking time to share with us from our wealth of knowledge. Doctor, do you have what you want to say, your last word?
What I actually want to say is that regardless of how handsome or beautiful somebody is, if that person is bringing, if there is halitosis, bad odor coming out from the mouth of that person, there's no way the beauty will not come out. So it's better to stick to good oral hygiene and be handsome and be beautiful completely.
All right. Okay, doctor, with what you just said now, before we wrap up, I would like you to just briefly tell us a bit about this KEDI Gum Care toothpaste. A little about the ingredient that makes it so special. Can you just tell us briefly about it, man?
This is our KEDI Gum Care. It's unique on its own, and it's an herbal ingredient. It has an herbal ingredient that is good. You know, an herbal ingredient will not leave any side effects. It's good. It is very good for halitosis, especially. it clears any halitosis away, and it heals wound, mouth ulcer, and whatever that is in the mouth. It's very good.
All right. Before we wrap it up, I have a question from Lawa Ahmed. He's saying, what products can we recommend for mouth ulcer patients?
Mouth ulcer.
Yeah, a patient suffering from mouth ulcer. What KEDI product can we recommend?
Yes, thank you very much. Like I said, the person too should know what is the cause of that mouth ulcer, like I said, but gum care, Vika, reishi, depending on the severity, whether you would deny fatu, but number one is gum care, gargle with reishi, and drink reishi 3 capsules twice a day. Vika contain vitamin C and any multivitamin drinks.
All right, and any multivitamin drink. So, before I take it a close for today, I would like to recite the Dr. Cap ethic for us one more time. It says a good oral hygiene is a foundation for preventing halitosis. So, brush twice daily, flush regularly, clean your tongue, and keep bad breath at bay with the best herbal formula and gum expert KEDI Gum Care toothpaste. Indeed, with this herbal toothpaste, you can be sure that your protection is sure. You can be sure that halitosis will be far away from you, irrespective of how severe it may be. Irrespective of how severe it may be, just ensure that you make use of our product, KEDI Gum Care toothpaste. Also, ma'am, we have the questions are just coming in. Please, you can keep bringing your question. There's another question from Amarachi Azuna. She says, for someone who wakes up in the morning and spit out blood, what is the solution?
Okay, Amarachi talks about somebody that spit out
blood just in the morning.
Like, Amarachi should know that spitting it out, the person should know where that blood is coming from. Is it from the oral cavity? Is it the teeth? Is it the mouth or whatever? Or is the person bringing out from inside? The person should be sure of that. If it is from the mouth, it's still the same thing that we are talking about, that the person will take. You use gum care. Let the person use the gum care, abundantly. Like, you brush, it's not the brushing alone, but make sure that you allow it to be in your mouth for about 2-3 minutes. Then gargle with salt water solution and gargle with reishi, and give the person reishi, which is an antibiotic, anti-infection. Let the person drink that one. You can put Godinefa and Vika too, but most specifically, let's know that the blood is coming from the oral cavity and not from the esophagus or gastric.
Yes. Okay. All right, ma. So, Amarachi Azuna, you've heard, we need to at first know where is this blood coming from, either from the oral cavity or from the internal GIT. It's bringing from the internal part of the body. There's another question from Pixel Tuna. Pixel is asking, ma, what period of time is ideal to use a brush, like for you to use a toothpaste? What period of time is the ideal time?
The ideal time is before you eat and after you eat. Some people say after eating in the morning, like the question you say, but if somebody knows that you brush well yesterday night, when it's even good you brush immediately you wake up the second day to clean the oral cavity and remove all the microorganisms that could be there that has been when you wake up in the morning, everybody knows that you will see that taste. That there are certain strangers, aliens that have been working in the oral cavity there. So you want them to go out, then you feel refreshed, even you will refresh, then you'll be able to eat. So in the morning. And the last thing, when you are going to bed, after brushing, when you want to go to bed, after finishing eating at night, you don't take any other thing again. This thing is discipline. Some people, after they finish eating, maybe they still not chewing gum, they still not take salt, they still not take alcohol, they still not take mineral. All those ones could lead to teeth decay. So it's mild before you eat and after you finish eating. the same day.
Okay.
It's the best, and take it judiciously. Use enough.
Okay, ma'am. So what is your take about someone that probably doesn't eat very early in the morning? They are not doing intermittent fasting, but there are some persons who are just cultured and like this way. They will not eat in the morning until, let's say, 12. Should that be the appropriate time for the person to brush?
The person should still brush
the moment he or she wakes up.
Once you wake up to start your day, because if you don't brush, you see this odor will still come out. But so you brush, you feel refreshed, and it's like taking it is like, if the way we are saying it's like taking medication.
Yes.
Because you take it to refresh the teeth and you make the place environment neat. So whichever way you now eat. Let's look at people that do fast. People that fast for like 6 hours, 8 hours, sometimes when you are with them, you realize a certain odor comes out from their mouth.
Due to just closure for
because they close the mouth, they've not eaten, you understand?
Yes.
So even people that, even when you eat too, you still help the mouth. The moment you don't eat, you leave the microorganism to be working and they be happy there. So it's good to brush whether you're fasting or not.
Okay. Ma, okay, how about this now? You said when you wake up in the morning, we should brush. But there is another contrast that says once you wake up in the morning, before you brush, you should take maybe a glass of water. So what is your take about that? Are we not taking in the microorganism that we want to take out?
Yes. That is another school of thought, because some people believe that when they drink that water, it will go to their stomach,
it will defecate and clean your colon.
Even when you brush, you drink the water, it will still do the same thing.
Wow.
It still do the same thing, whether you prefer to brush and
what is the best way, man? What is the best modality? That's the essence of this teaching. What's the best way? Is it the moment you wake up, you brush first before you take that water, or after taking the water? Which is the best way?
I believe that you brush before you take
water.
I believe that is what I would do for me to eat. I will brush before taking the water. But some people take water before they drink.
Yes.
So I think it's better to brush before drinking water. But for somebody who brushed like before you sleep, you can drink the water in the morning without brushing.
Okay. All right. A special thanks to our wonderful guest, Dr. Faniyi Tope Omolara. She has been indeed wonderful, and she has taken us through halitosis. In case you joined the broadcast late, don't worry. The full video will be available on our Facebook page at KEDI Healthcare Industries, on our Instagram handle at KEDI Healthcare _official. It will also be on our YouTube channel at KEDI Healthcare, and you can also check our mobile application, KEDI Care app. Feel free to watch and share with your loved ones, and don't forget to join us in the next edition of Talk to KEDI, because it promises to be insightful. Thank you so much for tuning in. Until I come your way next time, bye for now.